So my group, Chris, were charged with evaluating the magnitude of the disruption in cardiovascular care during the pandemic, and indeed during the various national lockdowns. Again, if I could get the slide deck up, thank you. The group was a multinational group, as you can see. And if we move on to the next slide, you'll see really where our focus lay. We wanted to understand the impact of diagnostic procedures, elective PCI acute coronary syndromes, and indeed on transcatheter heart valve procedures. This very important piece of work from the International Atomic Energy Agency reveals the magnitude of disruption to diagnostic procedures. This survey from over 800 centers worldwide shows about a 70% reduction in echo, about a 50-60% reduction in invasive and CT coronary angiography and stress testing, and really shows how diminished our capacity was to be able to diagnose and treat our patients with a variety of cardiovascular diseases. This slide was what we were all talking about during the lockdown, that we managed to preserve our STEMI pathways, but the patients went away. We saw about a 23% reduction in the number of patients presenting with STEMI and a 40% reduction in patients presenting with non-STEMI. Now, various reasons for this were proposed. Perhaps it was that patients were staying at home and in a less stressful environment, take more exercise because of lockdown, less air pollution. Maybe there were less acute coronary syndromes happening. Very damning data from the United States, from the National Center for Health Statistics, show a huge spike in the number of patients who died from ischemic heart diseases during March and April of 2020, really showing us that these patients were not at home and well. In fact, they were dying because they were not attending for cardiovascular care. On the next slide, you're going to see the impact from the global COVID TAVI study, which has been commissioned as part of the WeCare project. And we see that in approximately 27% of centers studied, elective TAVI procedures stop, while nearly 50% significantly reduced the elective TAVI procedures. The question is there an impact from delaying these TAVI procedures? And the answer is yes. Data from a variety of sources, including Switzerland and New York, show about 10% of patients will have a cardiac event, that is, hospital admission, stroke, or death within 1 month, and over a third of patients will experience an event within 3 months of TAVI deferral. So to summarize, Chris, we know that there's been a reduction in diagnostic procedures and outpatient care, a reduction in ACS presentations, and indeed in structural heart procedures, and that this reduction has increased mortality due to ischemic and valvular heart diseases. And as such, the project is committed to providing national and local strategies to avoid cardiac care deferral during future pandemia and lockdowns. And I'm going to quote that I found illuminating, that the diagnosis and treatment of cardiovascular disease should be designated a health priority that remains intact during pandemia, as the magnitude of harm induced by its interruption really is substantial.